Hello, everyone, and good afternoon. My name is Danielle Norwood, and I'm the host of the Danielle Norwood Show on 580 WIBW and FM News 1049. And today we're going to be spending a few minutes talking with Brad Sloan, who is the Detox Manager at Valeo Behavioral Healthcare here in Topeka, about Alcohol Awareness Month. Brad, thank you for joining our show.
Glad to be here, Danielle. It's good to see you again.
Good to see you too. And I understand that April is Alcohol Awareness Month. Why is it important to know that for our viewers today?
Well, having an Alcohol Awareness Month or a specific month set aside during the year when we bring attention to the problem of alcohol use disorder and alcohol abuse in the community, I think is important, and it helps to raise awareness about the issues revolving around that and the community resources that are aimed at addressing that and those kinds of things. So glad that it's a good thing that we've done for a number of years.
What is an alcohol abuse disorder?
Well, an alcohol abuse disorder is defined. I'm going to give you the medical definition. It's a chronic brain disorder marked by compulsive drinking, loss of control over alcohol use, and negative emotions when not drinking. So that's how the DSM describes an alcohol use disorder. For most of us, what it means is at the point when alcohol becomes an interference in how you're able to live your life. For example, if you go somewhere and you have a few drinks and make the poor decision to get into your vehicle and drive yourself home and you get a DUI as a result of that, that's an interference in your average everyday life function that alcohol has had an impact on. Is that an alcohol use disorder? No, but it is interfering with your life in a certain way and causing some pretty severe consequences. So it's probably something that you should probably take a good close look at.
Talk to us about binge drinking, because I have a few friends who would not consider themselves having a problem with alcohol, but anytime they're having some drinks, it always leads to more and more until they're way out of control. So talk to us about that.
Yeah, binge drinking is it's defined as a pattern of drinking that brings your blood alcohol levels above the legal limit to drive. And so now, in the way that most people think about binge drinking would be if someone starts drinking and then goes on a binge, and it lasts for a long period of time. But the definition that I just gave you is from the National Institute on Alcohol Abuse and Alcoholism, and so binge drinking could be considered anytime that you have enough drinks to become impaired enough that you cannot operate your vehicle.
So there are plenty of people who become addicted, and there are those who do not. How is it that somebody can become addicted and someone can't, or doesn't have those issues?
Well, there are so many factors that come into play as to whether or not someone becomes addicted to something, whether it's alcohol or anything else. For the purposes of this interview, we're talking about alcohol since it's Alcohol Awareness Month. But there's some research out there that indicate that kind of points to a genetic kind of thing where it's familial and it can be generational. There are environmental factors that come into play. Some people will even seek solace in alcohol when they experience something tragic in their family, say a death in the family or something like that. And that could lead, with prolonged and kind of constant use, could lead to an addiction. Now, here's what I would say is that most people who have drank, or I would say a lot of people who have drank, maybe not most, who have drank, have experienced at some point in their life a hangover. Mm-hmm. Right? A hangover is with withdrawal symptoms from alcohol. That's exactly what you're experiencing, is withdrawal from the alcohol. That's what a hangover is. Your body is telling you that it needs the alcohol in order to not feel the way that it does badly. When that becomes the imperative reason as to why you're drinking is to relieve that pain or some other pain, and that becomes your natural kind of go-to, that could be very easily viewed as as an addiction. Now, why is it that in some families you'll have two children, both of them are raised in the exact same environment? There's no indications of alcoholism in their immediate family or even maybe in their extended family. One of them grows up to be alcoholic and the other one doesn't. Again, there's a lot of different factors that play into that to determine, how someone becomes addicted. There's no way for the scientific community to be able to point at a child and say, yes, that one's going to be addicted and that one's not. We don't have that technology. I don't know that we ever will. There's so many factors that come into play that kind of determine who ends up being addicted and who doesn't.
What increases the risk of alcohol abuse disorder?
Well, a number of things. As I already mentioned, there can be a genetic link there. It could be family environment. It could be the family culture. A number of those kinds of things could predispose an individual to that. Certain childhood stressors could point someone in that direction as well. The other thing too is, being the community mental health center for Shawnee County here, we see a lot of folks who have diagnosed mental health issues that struggle with their mental health, and many times will use alcohol and other drugs as a way to self-medicate as well. As my example that I gave earlier, when somebody experiences a tragedy in their life and they begin to start drinking and things like that, that's an example of self-medicating. If those things are not addressed in a more wholesome way through therapies and grief processes and things like that, then without having a proper way to address the underlying issues, a person would certainly be prone to go down that road of alcoholism, drug addiction.
There used to be a public service announcement that ran that said, know when to say when. So, Brad, I'm going to ask you, how much is too much?
Oh, that's well. Here's what I would say.
Didn't mean to stump you.
These are all good questions, and I get these questions asked of me in the community when I do community presentations frequently, and what I find myself doing is answering them a little bit differently each time, because the answer is not the same for every person, and that's what I would say. However, we do have some legal guidelines that we can look to as the bar, so to speak. If you drink enough that you exceed the legal limit to operate a motor vehicle, then that's too much. Mm-hmm. Then that's too much. And that could be the bar. And again, like I said, for each person that's different. It depends on body metabolism. It depends on your size. It depends on whether you're male or female. It depends on a lot of different things. Some people would be able to drink a couple of drinks and not exceed that limit within an hour. Others would only be able to drink one drink or maybe even less, and they would be over that legal limit to operate a motor vehicle. So I would say that if it's looking like if it's looking like you're getting ready to, like you're going to break the law, then you've had too much. The other thing to keep in mind too, other factors, is it interfering with your home life? Is it interfering with your personal life? Is it interfering with your work life? Are you a public nuisance? I mean, all of these are questions that an individual has to ask themselves when they begin to ask the question whether or not they have a problem. And here's what I would tell you, is that most people who don't have a problem with alcohol never, ever ask the question about whether or not they might or might not have a problem with it. If that question has ever crossed your mind, even if fleetingly, then it's probably something that you need to take a good close look at, because those aren't the kinds of questions that would cross a normal person's mind.
And is that a sign?
I hate to use the word normal, but
Normal.
Yeah.
Yes.
Yes. Where's my camera? There we are. Normal.
Normal.
So,
yes.
Yeah.
So would that be one of the signs that someone needs to reach out for help?
Yes. I mean, if you're having those own kinds of personal questions where you're beginning to question whether or not using alcohol is becoming an issue in your life, suppose last night you went out and you had a few drinks with some friends. You didn't have any legal complications or anything like that, but you kind of made a fool of yourself, maybe you were at wherever you were having those drinks, you were dancing on the table, wearing the proverbial lampshade on your head, things like that. Those kinds of situations can be pretty embarrassing. If those things are happening frequently, and you're beginning to ask yourself the question, why am I doing this kind of thing? It's probably time that you reach out and talk to someone about these issues before it becomes a bigger problem and you do have legal issues and familial issues and work issues and things of that nature.
And how can friends and family get involved? Because I know some of the people who struggle with an addiction, in particular an alcohol addiction, would never bring themselves to say, I need help. But the people who love them and are around them obviously can see that there's some kind of trouble going on. How can we engage in the process to see if we can get our friends some kind of help?
Yeah, that's one of the very difficult things with people who are suffering from an alcohol use disorder, is that many times everyone around them sees the problem before they do, and some of that has to do with pride, some of it has to do with ego, not wanting to admit that there's possibly something again wrong with an individual. With themselves and things like that. As family members, usually what I tell them is that consistency in the message that you're trying to deliver to the person. In addition to tough love, which basically means that you don't want to do anything that enables that person's addiction, which can be very difficult for a family member, because many times what we think we are doing to help an individual actually is causing harm. Because alcoholics and addicts are very good at coming to their family members and saying to them, Danielle, I'm done. I swear I'm done. And they can be very convincing, and they can say, and come to you and say, as my sister, I need your help with this. I need you to bail me out. And I swear I'm done. I'm done. And that can be the very hardest thing for a family to do, is to look at that person and say, no, I'm done.
Yeah.
I'm not going to bail you out. I love you, but I'm not helping you by continually providing for your addiction. It's very difficult. It's easy for me to do because I've been doing this for a long time. It's a difficult thing for families to do, but it's something that needs to be done. Because as long as a person continues to enable their family member who's addicted, they're helping to kill that individual, and that's my personal opinion. Are they doing it intentionally? No, but they are helping that process, because a person in the midst of in the depths of their addiction is dying, and the same way as a person who has untreated diabetes is dying, and unless there's an intervention, unless there is something that stops that process, that person will die as a result of their addiction, and the family, for sure, most certainly does not want to be part of that as far as facilitating that.
As we get ready to wrap up, would you give us an overview of the services that Valeo offers?
Sure, absolutely. Obviously, we are one of the largest mental health centers in the state of Kansas. We're real fortunate to be here in Northeast Kansas in Shawnee County, and to be the community mental health service provider for Shawnee County. As such, we provide all of the normal mental health, again, I'm using that word, normal, typical is a better word, typical mental health services, from therapy to medication services, crisis services. We have some short-term housing services for those in need in that direction. We have myriad case management services, all those kinds of things on the mental health side. And then on the alcohol and drug abuse side, the substance abuse side, we have 5 different levels of care. We have a detox, a residential inpatient treatment program. We have 2 levels of outpatient care. Only because of the current health crisis going on right now, we're only utilizing 1 outpatient service right now instead of both of them. And then in better times, we also have a reintegration program that we utilize here as well. So, and we're hoping, really hoping and praying hard that maybe later this fall, or at the very least by this fall, but maybe next year at this time, when I talk to you again, Danielle, that we'll have all of our services back in place.
Well, if anybody is needing assistance, they can look at the crawl, which says valeotopeka.org. You have all of your information, all of your services listed on the website. And they could also call the number that's also been going through as we've been chatting today. So, Brad, I want to thank you so much for your time and your expertise, and just really appreciate what you're doing with everybody who's at Valeo, and your gift to the community by helping us to get our mental health and addictions taken care of, and just appreciate your team to the max. And thank you everybody for tuning in today for our chat with Valeo. And I am Danielle Norwood, hoping that you will make the best of your day.
All right. Thank you, Danielle.